So first we would knock, introduce ourselves to the patient, and do some hand hygiene. Hi there, I'm Dylan. I'll be your student nurse. We're just going to be administering some medications here in just a second. Close the curtains for some privacy. So we're going to identify the patient by looking at their wristband, checking both wrists to make sure that we have the correct person. That just came off. We'll just kind of put this back on real quick. There we go. Alrighty. So we're going to ask about any pain or allergies that they have. Make sure that the medications that we're giving don't interfere with any type of allergies. Since one of the medications is morphine, and plus you always want to kind of assess for pain. They're saying that we have a pain above 5, say 7 or so. So we're definitely going to give the morphine for pain. Before administering the medications, you want to look over their labs, as well as their vital signs, so make sure that nothing's contraindicated with the medications. Make sure the vital signs are stable enough to give something like morphine, which can depress the respiration. So everything seems to be normal for the patient. Also assess their lungs and abdominal sounds as well. Make sure that everything is normal, so nothing's contraindicated. So we're going to put on some gloves here and start prepping for administering the medications. And we would explain to the patient what they would be getting and the reason why they would be getting each medication, of course, as well. So we've pulled out some medications here. We've already ran through the first 2 checks to make sure that we have the correct dosages that we want, the correct medications. And now that we're at the bedside, we would make sure we're giving it to the correct patient as well. So you would compare their order sheet or their MAR of the medications with the name of the patient. And another part of verifying is we would come over here and scan the patient, their wristband, and then we'd come and scan each of the medications that we're going to be giving them. So it's put into the computer, and we would start with this back. Not actually opening this, it was just in the way. So we're going to give it in the order of easiest to most invasive for the patient. So we're going to start off with the hydrochlorothiazide. The orders state for 12.5 to be given once daily, 1 hour before a meal. So each pill is 25 milligrams, but it's a scored tablet, so we would split the tab. If it was an unscored tablet, or if they're MPO, and we would split the tab and give them half of it. So we would put the pill in a little container, and we would either give it to their hand and they could take it individually, and we'd give them a cup of water. If they're MPO, we can't give them water to ingest it. Next step would be the sub-Q, which is the enoxaparin sodium. So we're supposed to give 30 milligrams of it, and as it says on here, there's 100 milligrams per milliliter, so we want 0.3 milliliters. We're going to and we want to be sure not to touch the end of this and connect this directly to this. Push it on. And before taking it out of this, after removing this, we would wipe this down with an alcohol swab before injecting. So we're going to pull 0.3 of the enoxaparin out. And what I probably should have did is inject some air into this as well, because it would create a vacuum in this sometimes, making it more difficult to... I actually did not get any, so I put too far in. So we're going to withdraw. There's a big bubble in here. So we want to try and get all the air so they get an accurate dose of the medication. So we have to get the air out. I'm just going to make sure that I pull out 0.3 here. It's a long needle. Alright. So we've pulled out 0.3 of the enoxaparin. And so we're giving this subcutaneously. So we would pinch the skin. Well, first we would actually rub it down with an alcohol swab, but there's not one here at the moment. We'd go from the center to the outside. We would wait for it to dry, and then whenever we were ready to give the medication, we'd give it sub-Q at a 45-degree angle in, and then pull out at the same angle. I'm gonna lock the needle and pop it in the sharps container. So now the enoxaparin's done, we can move on to the morphine. And since they have a pain scale of 7, it's given PRN for 5. Let's see here. This is the enoxaparin. So there's 10 milligrams per milliliter, and we want to give 5 milligrams PRN. And since they are experiencing pain, we can go ahead and give it to them. So we want to pull out 0.5 milliliters as well. Alrighty, so we would rub the top of this as well with alcohol and prep for it. So, and we want to, oh, actually I'm gonna set this down before I inject it there, and we want 0.5 out. Some long needles. Get the air out of this as well. Make sure we do 0.5 here. And if there's anything in the orders that was contraindicated, or if we had any worries about the medications that we were administering, we would call the healthcare provider to seek clarification of the orders as well before giving any type of medication. So the air bubbles out, and I've withdrawn 0.5 milliliters, which is equivalent to 5 milligrams of the morphine solution. We're going to give this IM, so we would go in at a 90-degree angle, and we would give a C-track method since it's IM. So we'd push the tissue to the side, go down at a 90-degree angle, at least 1 inch, and we would give it at a rate of 1 mil every 10 seconds, so it's a slow push. Given it, we pull it out with the same angle, and then we would release from the Z-track method. And we would cap the needle as well and dispose of it. So now we've administered all the medications. We would assess how the patient tolerated being given each medication. And before giving the oral medication, I would also put the person in a high Fowler's position. If they couldn't stand being set up that high, probably about 45-degree angle or what's tolerated. But now that we've given the medications, we would reassess vital signs, lab work possibly, if required after giving a medication. So we're all done giving the medications. We would reopen up the blinds, lower the bed back down to its normal height, and do hand hygiene. And that's how we give medication.